I am Professor Archana Rajasundaram, an anatomist having 23 years of teaching and research experience. With over 36 publications, 8 patents, a contributor to the South Asian edition of Ross and Wilson Applied Anatomy and Physiology, and a member of Anatomical Society of India, I am happy to connect with you all in teaching anatomy. Let's start today's topic with a quick question. Are you all conscious of the muscles of the face when you contract, when you smile, or when you frown, when you are concentrating? Yes, today's topic is muscles of facial expression and sensory innervation of face. Objectives of this topic is demarcate the extent of face, describe the skin and superficial fascia, enumerate the sensory innervation of face, classify and describe the muscles of facial expressions. Extent of the face. The face is limited above by the hairline of the scalp, below by the chin and base of the mandible, on each side by the auricle. The forehead is common to both face and scalp. Skin and superficial fascia. The skin is highly vascular. This is the reason why there is profuse bleeding even on minor cut. It is rich in sweat and sebaceous glands. The acne which we see in the adults is due to the inflammation of these sebaceous glands with retention of secretion. The facial skin is elastic and provides attachment to facial muscles. Deep to the skin is the subcutaneous tissue or superficial fascia in which are embedded the muscles of the face, and there is no deep fascia in the face. Next, coming to the sensory innervation of face. The skin of the face is innervated by the 3 divisions of the trigeminal nerve, that is ophthalmic division, maxillary division and mandibular division, except in the case of the angle of the mandible, which is supplied by the great auricular nerve from the cervical plexus. Coming to the ophthalmic division, there are 5 nerves under ophthalmic division which innervate the face. They are supratrochlear and supraorbital, which supply the forehead and upper eyelid, infratrochlear, which supplies the lower eyelid, external nasal, which supplies the nose till the tip, lacrimal nerve, which supplies the lateral part of upper eyelid. Next, coming to the maxillary division of trigeminal nerve, it comprises of infraorbital, which supplies the lower eyelid, side of the nose and upper lip, zygomaticotemporal, skin over the zygomatic bone, zygomatical facial, skin of the temple. Mandibular nerve, it supplies the skin over the auricle and temple by the auriculotemporal nerve. Mental nerve supplies the lower lip and chin. Buccal nerve supplies skin over the buccinator. Trigeminal neuralgia. It is a neuropathic pain disorder affecting the trigeminal nerve. A common cause may be an artery or a vein pressing on the trigeminal nerve, but it can also occur without a clear cause. It can also be associated with other conditions such as multiple sclerosis, which requires treatment for the underlying condition. It leads to episodes of intense pain in the eyes, lips, nose, scalp, forehead and jaw. Coming to the muscles of facial expressions. Muscles of the face. These muscles are subcutaneous. They are embryologically derived from the second pharyngeal arch, and the muscles are innervated by the facial nerve. They take origin from the bone and are inserted into the dermis of the skin. These muscles are present around the orifices of the eye, nose and mouth. Functions. Primary functions of the facial muscle is to regulate the orifices, eye, nose and the mouth by acting as sphincters and dilators. They enable us to move the skin to create facial expression by pulling on the skin but do not move the facial skeleton. These muscles are grouped as circumorbital and palpebral muscle around the eye, nasal muscles around the nose and buccolabial muscles around the mouth and muscles of the scalp. We will see one by one. The circumorbital and the palpebral muscles, they are 4 in number. orbicularis oculi, which is a sphincter muscle, dilata muscle, which is a levator palpebrae superioris, corrugata supercilii, which brings about wrinkles of the forehead, and occipito frontalis, which also belongs to the scalp. This is described in the scalp as well. The frontal belly elevates the eyebrows and produces transverse wrinkles of the forehead as an expression of surprise. We will go in detail about the orbicularis oculi. This is a broad, flat, elliptical muscle. It surrounds the circumference of the orbit and it has three parts: orbital, palpebral and lacrimal. The orbital part takes origin from the medial palpebral ligament, frontal process of maxilla, nasal process of frontal bone. These fibers, they sweep around the orbital margin and are inserted into the skin in the lateral side of the orbit. Palpebral part, they take origin from the medial palpebral ligament. The fibers sweep laterally in front of tarsal plates of both the eyelids and they are inserted into the lateral palpebral ligament. Lacrimal part, this lies behind the lacrimal sac. It takes origin from the crest of the lacrimal bone and lacrimal fascia. The muscles divide into superior and inferior slip that inserts into the superior and inferior tarsal plates. Action of orbicularis oculi. Orbital part closes the eye tightly, protecting against the excess light. It causes wrinkle in the angle of the eye. Palpebral part closes the eyelids gently in sleep or in blinking. Lacrimal part draws the lacrimal papillae medially and dilates the lacrimal sac. Paralysis of orbicularis oculi results in drooping of the lower eyelid and spilling of tears. Nasal muscles. So these are 4 in number. Procerus, they bring about transverse ridges over the bridge of the nose. Nasalis has 2 components, the transverse part called the compressa nares and the ala part called the dilata nares. This assists in widening of the nasal aperture. The 4th muscle is depressa septi, which widens the nasal aperture. Next, coming to the buccolabial muscles. These muscles are present around the oral fissure, which consists of sphincteric component formed by orbicularis oris and a dilata component formed by a number of facial muscles which radiate outward from the lips. About 9 muscles converge around the oral fissure from each side and intermingle to form orbicularis oris. To the upper lip 3, to the lower lip 1, to the angle of the mouth 5. Muscles attached to the upper lip are 3 in number. These are levator labii superioris alegnasi, which elevates and everts the upper lip and dilates the nostril. Levator labii superioris and zygomaticus minor both elevates and everts the upper lip and increases the nasolabial furrow. Muscles to the lower lip is 1. The depressa labii inferioris, it draws the lower lip downward and somewhat laterally and helps in the expression of irony. Muscles attached to the angle of the mouth. Zygomatic major, levator anguli oris, depressa anguli oris, rhizoris and buccinata. There are 5 muscles. Zygomatic major draws the angle of the mouth upward and laterally as in laughing. Levator anguli oris, it raises the angle of the mouth. Depressa anguli oris, it draws the angle of the mouth downwards and laterally as an expression of sadness. Rhizoris, it retracts the angle of the mouth as in grinning. Next is the buccinata. So these muscles, they interlace to form a palpebral nodular mass, the modulus, which is situated just lateral to the angle of the mouth, opposite the upper second premolar tooth. We will see in detail about the buccinata muscle. This is a thin muscle of the cheek. It takes origin from the outer surface of the alveolar process of maxilla and mandible opposite the 3 molar teeth and from the pterygomandibular raphe. It gets inserted into 3 fibers, that is upper, middle and lower fibers. The upper or maxillary fibers, they pass straight to the upper lip. The lower or mandibular fibers, they pass straight to the lower lip. The intermediate group, they undergo a chiasmatic decussation at the modulus. Upper fibers goes to the lower lip and the lower fibers goes to the upper lip. Action of buccinata muscle is to compress the cheek against the teeth, to keep the food in place while chewing, and to pull the corners of the mouth sideways, which aids in action like whistling, sucking and smiling. Paralysis of buccinata muscle is often caused due to facial nerve damage, or it's called as the Bell's palsy. This causes difficulty in chewing, speaking and smiling, leading to food pocketing, drooling and cheek biting. Next, coming to the muscle orbicularis oris. This muscle is a sphincter of the oral aperture. It is present within and around the lips. It closes the lips, protrudes them and compresses them against the teeth. Together with the buccinata, this muscle helps to hold the food between the teeth during mastication. Orbicularis oris comprises of two parts, an extrinsic and an intrinsic part. Extrinsic part is further divided into deep stratum, intermediate stratum and superficial stratum. Oblique fibers from skin to the mucous membrane of the lip comprises of the intrinsic part. Superficial stratum of orbicularis oris comprises of levator anguli oris and depressa anguli oris. These two muscles cross each other at the angle of the mouth. The fibers from the levator anguli oris pass to the lower lip and the fibers from the depressa anguli oris pass to the upper lip. The intermediate stratum comprises of the buccinata muscle, which we saw earlier. The upper fibers goes to the upper lip, the lower fibers straight to the lower lip. The intermediate fibers crossed at the modulus and reach the opposite lips. Deeper stratum of orbicularis oris is formed by two muscles, incisivus superior and inferior muscle. And incisivus superior muscle is from the incisive fossa of the maxilla, and incisivus inferior muscle is from that of the mandible. These muscles arch laterally and are continuous with each other at the lateral angle of the mouth. Intrinsic part of orbicularis oris comprises of oblique fibers which extend from the skin to the mucous membrane of the lip. It is called the pars marginalis and is located within the vermilion zone. Action of orbicularis oris. It closes the lip. The deep and the oblique fibers compress the lips against the teeth and help in mastication. The superficial fibers protrude the lips as in pursing. The intrinsic movement of the lips help in articulation of speech. Paralysis of this muscle impairs lip closure, leading to drooling, difficulty in eating, drinking and dysarthria. Mentalis is a muscle which is present in the chin and it protrudes the lower lip in drinking or expression of disdain. To sum up, let's see the muscles which bring about the facial expression. Frowning, corrugata supercilii by vertical wrinkles of forehead, procerus by transverse wrinkle across the root of nose. Surprise, horror or fright. This is brought about by the frontal muscle by elevation of the eyebrows and transverse wrinkles of the forehead. Anger, dilata nares and depressa septi by dilating the anterior nasal aperture and depressing the mobile part of the septum. Sadness, levator anguli oris, levator labii superioris and zygomaticus minor by making the nasolabial furrow prominent. Depressa anguli oris by drawing the angle of the mouth downward and laterally. Laughing, zygomaticus major by drawing the angle of the mouth upward and laterally. Irony, depressa labii inferioris by drawing the angle of the mouth downwards and somewhat laterally. Grinning, rhizoris by retracting the angle of the mouth laterally. Disdain, mentalis by puckering the chin and protruding the lower lip. Bell's palsy is seen in paralysis of facial muscles, which will be dealt in the next topic. Thank you.